Hey everyone, welcome back to Speak Healthy. Today, we are going to talk about heart disease and the many ways to combat it. Heart disease is one of the leading causes of death worldwide, accounting for millions of deaths each year. It is a chronic condition that affects the heart and the blood vessels that supply it. While there is no cure for heart disease, it can be managed through lifestyle changes and medications. Making smart goals and incorporating tips for fighting heart disease into daily life can make a significant difference in managing the condition and improving the quality of life. In this video, we will explore some practical tips and strategies for living with heart disease, focused on setting smart goals that are specific, measurable, achievable, relevant, and time-bound. These tips and strategies can help individuals with heart disease make meaningful changes to their lifestyle, reduce their risk of complications, and improve their overall health and well-being. Number 1. Heart disease is a broad term used to describe a range of conditions that affect the heart and blood vessels. It is often caused by buildup of plaque in the arteries, which can lead to a narrowing of the blood vessels and reduce blood flow to the heart. There are several different types of heart disease, including coronary artery disease, arrhythmias, heart failure, and heart valve disease. Coronary artery disease is the most common form of heart disease and occurs when the arteries that supply blood to the heart become narrowed or blocked. This can lead to chest pain, shortness of breath, and heart attack. Arrhythmias, on the other hand, are irregular heart rhythms that can cause dizziness, fainting, and palpitations. Heart failure occurs when the heart is unable to pump enough blood to meet the body's needs, leading to symptoms such as fatigue, swelling in the legs, and shortness of breath. Heart valve disease is another form of disease that occurs when one or more of the heart valves don't work properly, causing blood to flow in the wrong direction. In addition to these different types of heart disease, there are also several risk factors that can contribute to its development. These include high blood pressure, high cholesterol, smoking, diabetes, obesity, physical inactivity, and the family history of heart disease. Understanding these risk factors and how they contribute to heart disease can be an important step in managing the condition and reducing the risk of complications. There are several ways to reduce the risk of heart disease, including making lifestyle changes and taking medications as prescribed by a healthcare professional. Some lifestyle changes that can help reduce the risk of heart disease include following a heart-healthy diet, engaging in regular physical activity, quitting smoking, managing stress, and getting enough sleep. In some cases, medication may also be prescribed to manage risk factors such as high blood pressure, high cholesterol, or arrhythmias. Overall, understanding heart disease and its risk factors is an important part of managing the condition and reducing the risk of complications. By working with a healthcare professional to develop a personalized treatment plan, individuals with heart disease can take steps to improve their heart health and overall well-being. Number 2. Lifestyle changes are a critical component of managing heart disease. These changes can help control and reduce risk factors associated with heart disease and can improve heart health over time. Some of the lifestyle changes that can be beneficial for individuals with heart disease include exercising regularly, quitting smoking, following a heart-healthy diet, managing stress, and getting enough sleep. Regular exercise is one of the most effective lifestyle changes for managing heart disease. Exercise can help strengthen the heart muscle, reduce blood pressure, and improve cholesterol levels. According to the American Heart Association, adults should aim for at least 150 minutes of moderate exercise or 75 minutes of vigorous exercise per week, spread out over at least 3 days. Examples of moderate exercise include brisk walking, cycling, or swimming, while examples of vigorous exercise include running, playing sports, or doing high-intensity interval training. Quitting smoking is another important lifestyle change for managing heart disease. Smoking is a major risk factor for heart disease, and quitting can help reduce the risk of complications. Nicotine replacement therapy, counseling, and support groups can all be helpful for individuals who are trying to quit smoking. Following a heart-healthy diet is also important for managing heart disease. This typically involves eating a diet that is rich in fruits, vegetables, whole grains, and lean protein, while minimizing consumption of saturated and trans fats, salts, and added sugars. The Mediterranean diet, which emphasizes plant-based foods, lean protein, and healthy fats, is a popular diet for individuals with heart disease. Managing stress is another important lifestyle change for managing heart disease. Chronic stress can increase the risk of heart disease and worsen symptoms in individuals who already have the condition. Strategies for managing stress can include mindfulness practices, yoga, meditation, deep breathing exercises, or seeking professional counseling. Getting enough sleep is also critical for managing heart disease. Poor sleep quality and duration have been linked to an increased risk of heart disease, high blood pressure, and other health problems. Individuals with heart disease should aim for 7 to 8 hours of quality sleep per night and consider implementing a regular sleep routine that includes a relaxing bedtime ritual and avoiding screens for an hour before bedtime. Number 3. In addition to lifestyle changes, medications are an essential component of managing heart disease. Different medications are prescribed based on the specific type of heart disease and individual risk factors. Here are some of the most common medications prescribed for managing heart disease. Statins. Statins are a class of medications that are used to lower cholesterol levels in the blood. High levels of cholesterol can lead to the buildup of plaque in the arteries, which can increase the risk of heart disease. Statins work by blocking the enzyme that produces cholesterol in the liver, thereby reducing the amount of cholesterol in the blood. Beta blockers. Beta blockers are medications that are used to slow down the heart rate and reduce blood pressure. They are commonly used to treat conditions such as arrhythmias and heart failure. Beta blockers work by blocking the effects of adrenaline, which can help to reduce the workload on the heart. ACE inhibitors. ACE inhibitors are medications that are used to lower blood pressure and improve blood flow to the heart. They work by blocking the action of angiotensin converting enzyme, ACE, which helps to relax the blood vessels and reduce the amount of work the heart has to do. Diuretics. Diuretics are medications that are used to remove excess fluid from the body, which can be helpful for individuals with heart failure or high blood pressure. They work by increasing the production of urine and reducing the amount of fluid in the blood vessels. Antiplatelet agents. Antiplatelet agents are medications that are used to prevent blood clots from forming. They are commonly prescribed for individuals who have had a heart attack or stroke. Antiplatelet agents work by preventing platelets in the blood from sticking together and forming clots. It is important to work closely with a healthcare professional when taking medications for heart disease. They can help determine the right medications and dosages based on individual risk factors and overall health. It is also important to follow the prescribed dosages and to not stop taking medications without consulting with a healthcare professional. By taking medications as prescribed, individuals with heart disease can help manage the condition and reduce the risk of complications. Number 4. Setting SMART goals and monitoring progress is an essential part of managing heart disease. By tracking progress, individuals can better understand their health and stay motivated to make the necessary lifestyle changes and take medications as prescribed. Here are some effective methods for tracking progress. Keeping a journal. Keeping a journal is a simple but effective way to track progress. Individuals can record their daily activities such as exercise, diet, and medication use and note any symptoms they experience. This can help them identify patterns and make necessary adjustments to their routine. Additionally, writing down thoughts and emotions can also help manage stress and improve overall mental health. Using an app. There are many apps available that can help individuals track their progress. These apps can track activities such as exercise, diet, and sleep, as well as provide reminders to take medications. Some apps also provide feedback and recommendations for improving their heart health. Examples of heart disease apps include MyFitnessPal, MyPlate, and Blood Pressure Companion. Working with a healthcare professional. Working with a healthcare professional is one of the most effective ways to monitor progress. Healthcare professionals can perform regular checkups and tests, such as blood pressure and cholesterol checks, to monitor progress and adjustment treatment plans as needed. They can also provide personalized recommendations for lifestyle changes and medications based on individual needs. It is important to set SMART goals when tracking progress. SMART goals are specific, measurable, attainable, relevant, and time-bound. For example, a SMART goal could be to exercise for 30 minutes a day, 5 days a week, for the next 3 months. This goal is specific, measurable, and time-bound, making it easy to track progress and stay motivated. Number 5. Coping with emotional challenges is a critical part of managing heart disease. Heart disease can cause significant emotional distress, including anxiety, depression, and feelings of uncertainty or loss of control. Coping with these emotions is essential to maintaining good mental health and improving overall quality of life. Here are some effective strategies for coping with emotional challenges related to heart disease. Seek support. Seeking support from friends, family, or a support group can be a valuable source of emotional support. It can be helpful to connect with others who are also living with heart disease, as they can understand the emotional challenges and offer practical advice and support. Practice stress management techniques. Practicing stress management techniques such as deep breathing, meditation, or yoga can help reduce stress and improve emotional well-being. These techniques can also help manage physical symptoms such as high blood pressure or chest pain that can result from stress. Focus on positive thinking. Focusing on positive thinking can help shift negative thoughts and emotions. This can include setting realistic goals, expressing gratitude, and focusing on positive aspects of life. Keeping a journal or gratitude diary can help individuals focus on positive thoughts and feelings. Consider professional counseling. Professional counseling can provide valuable support for individuals dealing with emotional challenges related to heart disease. Counseling can help individuals develop coping strategies, improve communication with loved ones, and manage stress and anxiety. Engage in enjoyable activities. Engaging in enjoyable activities such as spending time with loved ones, listening to music, or pursuing a hobby can help improve mood and overall well-being. It's important to remember that everyone copes with emotional challenges differently. What works for one person may not work for another. Therefore, it's important to explore different coping strategies to find what works best for each individual. In addition, it's important to seek professional help if emotional challenges are severe or persistent. A healthcare professional can help develop a personalized plan for managing emotional challenges and improving overall mental health. Number 6. Building a support network is an essential part of managing heart disease. Support networks can provide individuals with the emotional and practical support needed to manage the condition and improve overall quality of life. Here are some different types of support networks that can be beneficial for individuals with heart disease. Family and friends. Family and friends can be an excellent source of support for individuals with heart disease. They can provide practical assistance with tasks such as grocery shopping or transportation to medical appointments. They can also provide an emotional support such as listening and offering comfort during times of stress or anxiety. Healthcare professionals. Healthcare professionals such as doctors, nurses, and dietitians can provide essential medical support and advice for individuals with heart disease. They can help manage the condition through medication, lifestyle changes, and other medical interventions. Support groups. Support groups can be a valuable source of emotional support for individuals with heart disease. These groups provide a safe space for individuals to share their experiences and feelings with others who understand what they are going through. Support groups can be in person or online, and they often offer educational resources and practical advice for managing heart disease. Community programs. Community programs such as cardiac rehabilitation programs can provide a supportive environment for individuals with heart disease to learn about the condition, manage symptoms, and improve their overall health. These programs often include exercise classes, educational resources, and social support. It's important to remember that building a support network is an ongoing process. It may take time to find the right sources of support, and the network may evolve over time as individuals' needs and circumstances change. Some tips for building and maintaining a support network include: reach out to others. Don't be afraid to reach out to others for help and support. Let family, friends, and healthcare professionals know what you need and how they can help. Join a support group. Joining a support group can be an excellent way to connect with others who are going through similar experiences. Stay connected. Keep in touch with family and friends regularly, and don't be afraid to ask for help when you need it. Participate in community programs. Participating in community programs can be an excellent way to meet others with heart disease and learn about new resources and strategies for managing the condition. Number 7. The future outlook for heart disease management is promising, as ongoing research and development are leading to new treatments and strategies for preventing and managing the condition. Here are some developments that individuals with heart disease may find encouraging. Advancements in medical technology. Advances in medical technology are making it easier to diagnose and treat heart disease. For example, new imaging techniques are helping doctors to detect heart disease earlier and more accurately, while minimally invasive procedures are allowing for less traumatic interventions. Personalized medicine. Personalized medicine is an emerging approach to treating heart disease that takes into account an individual's unique genetic, lifestyle, and environmental factors. This approach is allowing for more targeted and effective treatments that can improve outcomes for individuals with heart disease. Health informatics and digital health. Health informatics and digital health technologies are making it easier to collect and analyze health data, allowing for more precise diagnosis, treatment, and monitoring of heart disease. These technologies can also help individuals to manage their condition more effectively by providing real-time feedback and personalized recommendation. Focus on prevention. There is increasing recognition of the importance of preventing heart disease through healthy lifestyle choices and early intervention. Public health initiatives are focusing on educating individuals about the importance of maintaining a healthy diet, engaging in regular physical activity, and avoiding smoking, among other lifestyle factors. While the outlook for heart disease management is promising, it's important to note that the prevalence of heart disease is expected to continue to rise in the coming years. This highlights the ongoing importance of early diagnosis and intervention, as well as continued efforts to promote healthy lifestyle choices and prevent the development of heart disease. Living with heart disease can be a challenging experience, but by setting smart goals and adopting healthy habits, individuals with heart disease can manage their condition effectively and improve their quality of life. Through lifestyle changes, medication, monitoring progress, coping with emotional challenges, building a support network, and keeping up with new developments, heart disease research and treatment, individuals can take a holistic approach to managing their condition.